Hi everyone, welcome to 5 Minute Video Study for the NCE. Today we are going to be covering treatment planning, and we are in subtopic E, which says refer to different levels of treatment: outpatient, inpatient, residential. So what do those treatments mean? And when is it appropriate for those different types of treatment? Or you may also hear levels of care. So again, level of care refers to the range of available mental health services, varying in frequency, intensity, and duration. Often the person needs to be made aware that they have options, and that based on the symptoms and the severity, then that there would be a collaborative effort to determine the best range of care for that individual. So the first level that we'll talk about is inpatient hospitalization, or sometimes just referred to as inpatient. So these are for individuals who might be suicidal. They might be experiencing psychiatric psychosis, manic episodes that pose a safety risk for themselves and others. So the primary goal of inpatient hospitalization or inpatient treatment is stabilization as well as safety. So, if that individual is saying, I'm going to harm myself or somebody else, I have a plan, I have a weapon, then an inpatient hospitalization would be appropriate. But, you have to be very clear, because a lot of times the client might be resistant, or they may not feel the need. So inpatient units are monitored 24 hours a day. A lot of times they're in hospitals or treatment facilities. Typically, an inpatient client stays short term. That short term can be anywhere from 3 to 7 days. And based on the symptoms and kind of the different types of medications that are needed, again, the goal is stabilization as well as safety. And as you can imagine, this is also the most expensive level of care, because of the intensity and the monitoring and the staff that are needed in order to provide that level of care. The next level of care, which is less intense, is called residential treatment, or residence. Residential programs are well monitored but significantly less restrictive than inpatient. Critical differences from inpatient include the length of the program, the setting, and the treatment goals. Typically, the residential treatment is long term, with an average length of stay ranging from 30 to 90 days or longer, depending on the program. Residential treatment patients participate in group therapy, individual therapy, as well as psychiatric care in a community-like environment. At this level of care, the individual is normally working towards personal goals. Residents learn about values of being part of a therapeutic community and improving interpersonal skills. So, in treatment facilities, that's normally the process. And with managed care, many times insurance does not cover these types of residential treatments, because as you can imagine, they're expensive. So many times these types of levels of care may only be accessible to those with that type of disposable income. The next level of care is PHP, or partial hospitalization program. So this is a discharge from the residential program. Participants in partial hospitalization programs, or PHP, they usually meet 7 days a week for 6 to 8 hours. So it's usually during the day, and then patients in the PHP is less intense than inpatients residential. But PHPs does not require overnight stays. So they might go like from 9 to 3, They might do the therapy, the group therapy, the types of treatments that a residence has, but then the difference is they're not sleeping there. They would go to their normal residence. The next level of care is IOP, or intensive outpatient therapy, and here usually they incorporate group and individual therapy for 3 hours a day, and then they might meet 3 to 5 times a week. So IOP is a good option for those that would still benefit from structured treatment program while having the flexibility of their day to day, so like work or school, and their routines. Average duration of IOP can be anywhere from 8 to 12 weeks, depending on their goals. And finally, outpatient therapy, which is the lowest level of care. And that typically involves a therapist or psychiatrist with an individual and the medication management. So, they normally go once a week for 45 to 50 minutes. And, the intensity is certainly less. So just remember inpatient, residential, partial hospitalization, intensive outpatient, and then outpatient. So those are the different levels from most intense to least.